Hello everyone, I am Hamza Azhar. I am a final year medical student. Today I am going to talk about emerging role of artificial intelligence in thyroid nodule assessment. So let's talk about the definition of artificial intelligence. So it is actually the ability of a computer to behave like human beings. Humans are pattern recognizing machines. In AI, we teach the computer to recognize patterns just uh, in the same way as humans do. Recently, we conducted a survey where we asked different surgical professionals about their perception about artificial intelligence. We asked them different questions about the basics of AI. So our results showed that most of the participants were not familiar with the basic concepts of artificial intelligence. However, a general acceptability towards integration of AI in medical and surgical practice was observed. So let me ask you a very stupid question. Uh, can you tell me what comes after 1, 2? Most probably you are going to say 3 and 4. But how did you answer that? So uh, the most simple explanation is that humans are pattern recognizing machines. We have recognized a pattern that accounting from 1 to 7 is written here, and uh, we recognize this pattern and we said that 1 to the 3 and 4 is going to come after the 1 and 2. Computer is just the same. Images, to the computer, images are a collection of numbers. Here I have an image of ultrasound of the thyroid. So to a computer, this is not an image of the thyroid gland. Rather, it is just a collection of numbers. Uh, in AI, we teach the computer to recognize a pattern in these numbers. So this image is going to be converted into numbers, and in AI, we will teach the computer to recognize a pattern in those numbers. Let's talk about the need of AI for the assessment of thyroid nodules. The most widely used and the most reliable investigations that we do for the assessment of thyroid nodules are ultrasound of thyroid gland and fine needle aspiration cytology. The assessment of these investigations are uh, this is actually very subjective, and it depends upon the experience of radiologists. Uh, we have used artificial intelligence to actually assess these investigations, the ultrasound and the FNAC. And AI has been reported to meet or even exceed the human experts in radiology. So as we have already discussed that the images are just a bunch of numbers for the machine, and in AI we teach the machine to recognize a pattern in those numbers. So similar patterns are being, uh, the machines are being taught to recognize these patterns in ultrasound images. The features that are being used as pattern for the training of those AI systems include shapes, the margins, acugenicity, calcification, composition, and size on the ultrasound. The texture features, that is the spatial distribution and the surface orientation on the ultrasound of the thyroid, has also been used as a pattern on which the AI-based models have been trained. Um, Accuracy of 94.6% has been achieved with this. Uh, as we have already discussed, that FNAC is one of the most reliable investigation that we do for the assessment of the thyroid nodules. We have used AI for assessment of the cytopathology, the morphological features like the nuclear morphology and the papillary structure has been used for the diagnosis of the papillary thyroid carcinoma. And these features are actually used as the patterns for training of the AI-based models for the diagnosis. A 97.6% accuracy has been achieved when we used AI for the diagnosis of papillary thyroid carcinoma. One of the most challenging thing that we face is to differentiate between the follicular adenoma and carcinoma on the ultrasound of the thyroid gland. So we have used AI-based models. Earlier, we took the margins of the ultrasound and we trained the AI-based model to recognize the patterns in that particular ultrasound image. And we achieved 89.5% accuracy with that. Later, the whole lesion was actually analyzed with the AI-based model and 96% accuracy was achieved. The indeterminate pathologies, the nodules which are cytopathologically indeterminate, the recommendations for those nodules is that we repeat the fine needle aspiration. Molecular testing gives non-invasive option for those patients. So it is very important investigation in those cases. In the molecular testing, we actually analyze the genome of the patient, but the genome has vast amount of information, and it is very hard to analyze the entire genome. So here, the pattern recognition ability of the AI comes in handy, and this ability of AI makes it possible for the machine to recognize patterns and to handle that vast amount of information there. 94% sensitivity and 82% specificity has been recorded with the use of AI system in the molecular testing. Obviously, there are some limitations of AI in the nodule assessment. The use of AI for the diagnosis of medullary thyroid carcinoma and the anaplastic carcinoma is still very limited. For the training, as we have already discussed, that the AI-based models are trained for the recognition of the patterns. So it requires a lot of a very big data set for the training of that model. And in most cases, we do not have that large of a data set. And obviously, for the training of the models and the equipment that is used for the AI-based system is very very expensive, and there is a financial burden. That is another limitation of AI-based nodule assessment. Currently, we are working on a project. ATA, that is American Thyroid Association, has some guidelines for the management of thyroid nodules. We are collaborating with the programming team, and we are developing a software that is based upon these guidelines. The actual goal of this software is to provide a proper management system for the nodules, the thyroid nodules, according to the ATA guidelines, and this entire software will be AI based. So basically, for this, we have to know about the different types of data sets. We have two types of data sets. One is the training data set and the other is testing data sets. In the first phase, we actually train the AI model to recognize different patterns. So in the first phase, we train the AI model on a large amount of data. That data is going to be called as the training data set. And once the machine is trained, it is tested on the testing data set. There are two ways in which we can actually train the machine. The first one is the supervised learning model, and the other is unsupervised learning model. So in the supervised learning model, that training data set is actually labeled according to our needs. In our case, we are going to label the data according to the American Thyroid Association guidelines. And in unsupervised learning model, the AI-based system learns or it is trained on the training data set without the manual labeling of the training data set. So once we train our training data, once we are done with the training of our AI-based system, we will get the IRB approval, and with that, the AI-based model will be tested on the testing data set. That is all of the patients that are going to get the thyroid surgery at our hospital. All of them will be included in the testing data set. Thank you, everyone.